Hello, this is Dr. Dylan Kruger. Today we're going to take a look at a meta-analysis on knee pain, specifically osteoarthritis as the condition, and different injection types. So we're going to examine a study that looked at hyaluronic acid versus corticosteroid injections versus saline, the placebo, versus PRP or platelet-rich plasma. So this was a large-scale meta-analysis. It had very good information, and that's why I wanted to take a moment today to just review and kind of share what was found in this study and what we can gain from this knowledge moving forward. So the study we're going to be examining today is called Comparison Between Intra-Articular Infiltrations of Placebo, Steroids, Hyaluronic, and PRP for Knee Osteoarthritis, a Bayesian network meta-analysis. This study was published in the summer of 2020, so it's relatively new and it was a large-scale analysis. So let's take a deeper look here. All right, so this was a meta-analysis. It was slightly different than the traditional meta-analysis that you will typically see, where this study actually used a Bayesian network meta-analysis. Now, the Bayesian it's very similar to the traditional meta-analysis, where it's looking at a collection of studies trying to find a universal, large, big picture conclusion that we can reach upon these similar studies that are pooled together based on different criterion that the researchers select. Now, the Bayesian, they actually use a different statistical analysis to come up with their conclusions and how they pool it together. But that's getting in the weeds a little bit here. Basically, it is just it's a different analytical method to come up with their meta-analyses. So just to touch on the Bayesian one more time before we move on, it does incorporate external evidence, such as other effects of interventions and variation amongst the studies. It also incorporates some decision-making context that allows physicians or clinicians to potentially use the data and information from these studies in more of a real-world setting potentially. They also are going to be comparing multiple treatment modalities combined into a meta-analysis here. But overall, I would just say I wouldn't focus on the Bayesian necessarily. It's just a different take and statistical algorithm and analyses to derive their conclusions. It is a very impressive, detailed method, relatively rare for researchers to use this, but it does produce very good results when you look at their meta-analyses derived from these statistical methods. So before we get into the details of the study we're going to be examining here today, there's just a couple background terms I want to familiarize the audience with. And some of you might already know of this if you actually are suffering with chronic knee pain, or any of the clinicians that may be listening to this video. So the study abbreviates VAS, Visual Analog Scale. Now, this is very common in pain management, even in primary care. Many people have probably came across this, and I included a graphic to familiarize yourself that many of you have probably already seen at some point through the years. But basically, the visual analog scale is a pain scale on a 0 to 10 metric, with 10 being the most pain and 0 being no pain. And a clinician can give this to the patient and let them judge and select where they are at currently on that pain scale. And it's a way for them to quantify not only the baseline of pain before therapeutic intervention, but as well as a way to monitor the progress through the treatment And in this case, they monitored the progress at baseline, 3 months, 6 months, and 12 months. This is a very kind of an old school, I would say, way, but still very effective. And the nice thing is it's super easy to implement. It doesn't take much time, and it's very easy for the patient to kind of select where they're currently at. All right, so the study also, in addition to using a visual analog scale, they also referenced the WOMAC. The WOMAC has been around for some time now as well, and it's the Western Ontario and Macmaster University's Arthritis Index, so WOMAC. This is very common for hip and knee osteoarthritis. It's more detailed than the visual analog scale. So it not only rates pain, but it measures pain during walking, going in the stairs, bed, sitting or lying, and standing. It also judges stiffness as well, and this is what makes it really unique, is physical function. And it's very comprehensive on its physical function metrics. So it incorporates many daily living activities such as stairs, standing, bending, walking, getting in the car, putting your socks and shoes on, bathing, toilet, etc. So it's more detailed than the visual analog scale because it asks many more questions and it has different categories than just a 1 through 10 number. I prefer it to the visual analog scale, but both have good value. The WOMAC does take more time for the patient complete, but it is still relatively simple and most patients can complete this within 5 to 10 minutes on their visit. All right, so let's introduce you to the study that we're going to be examining here today. Now, this study regards the efficacy of intra-articular injections of platelet-rich plasma, PRP, for short, hyaluronic acid, such as Synvisc, Orthovisc, etc., and corticosteroids, such as Cortisone, etc. Current evidence is controversial amongst the three. The superiority of one technique over another is questioned and debates are ongoing. The purpose of present study was to compare and investigate the efficacy of these intra-articular infiltrations, injections, in the patient with knee osteoarthritis, OA osteoarthritis. A meta-analysis of randomized controlled trials was conducted on patient outcomes at 3, 6, and 12-month follow-up. And randomized clinical trials are the most accurate way of assessing the therapeutic outcomes and indications of a modality or treatment. So this is kind of the gold standard in research and evidence-based medicine. All right, so the authors, when they're doing a meta-analyses, they have to come up with their method on inclusion criterion and decide what studies they want to examine and include into the analysis and what studies that don't meet their standards that they may think are weaker studies or don't match the randomized control model they're looking at. Now, they did a Bayesian meta-analysis here, and they did a systematic review incorporating healthcare interventions, in this case, knee osteoarthritis injections. And they were looking at randomized trials that didn't only look at one intervention, but specifically randomized control trials that compared 2 or more intra-articular knee injections therapeutics for knee osteoarthritis. So it has to be at least 2 is what these authors were looking at here. So it's a good way to assess comparisons, and that's why we're talking about it here. And they looked at the outcomes based on the WOMAC and visual analog scores, which we previously introduced. It was a very well thought out study and very interesting in the fact that it's going to be comparing multiple treatments within a meta-analysis. All right, so we had previously mentioned they were using randomized controlled trials, and these were trials that looked at least 2 injection interventions for knee osteoarthritis. the authors used 30 total trials that met the criterion they were looking at. And that's a good number for a meta-analysis. It's a very healthy number that you can reach some good conclusions based off that. So the 30 randomized controlled trials consisted of a total of 3,463 patients. Once again, that is a good number as well for a meta-analysis. So they're going to look at these interventions, and they're going to compare them at baseline, 3-month follow-up, 6-month follow-up, and 12-month follow-up. And they're going to measure the outcomes based on these 30 randomized controlled trials, once again with the visual analog scale, VAS, that's the 1 through 10, and then the WOMAC scores. All right, so once again, we're looking at 30 randomized control trials, almost 3,500 patients in the meta-analyses here. So let's take a look at the WOMAC scores at the 3 months. So 3-month outcomes for these knee injections of three treatments plus a placebo injection. So WOMAC at 3 months, the PRP injection had the best results and most pain relief and biggest increase in functionality. This was followed by placebo. And then coming in third was a corticosteroid injection, and fourth is hyaluronic acid injections on the WOMAC 3-month follow-up. So this is interesting for a number of reasons. Mainly what's jumping out is that the placebo actually scored higher than corticosteroids and hyaluronic acid. I'm speculating here just off some clinical experience, in my opinion, that the corticosteroids do give you good pain relief up front, but it can wear off as time progresses. So the corticosteroid injections may have had provided some good pain relief maybe at the 1-month follow-up and maybe even at the 2-month. But maybe at the 3, this started to dissipate, and because the patient had a compromised knee, but it was feeling good from a steroid injection, they might have done more activities than they should have, which ultimately possibly could have made that joint worse and explain why placebo was better than the steroids. And the same can be said for hyaluronic acid, which provides relief typically up front and wears off over time, and that's why you have to repeat it multiple times as the patient progresses in their knee pain and osteoarthritis. All right, so we just took a look at WOMAC at 3 months. Let's take a look at the WOMAC results at 6 months follow-up for the comparison between hyaluronic acid, steroid injections, and platelet-rich plasma injections. So at 6 months, platelet-rich plasma provides the best results, followed by hyaluronic acid, corticosteroids, and in fourth, placebo. So this is different than what we were seeing at the 3-month follow-up. At 3 months, PRP was number 1, and it's still number 1 at 6 months. But now placebo has now moved from the second position down to number 4, and corticosteroids and hyaluronic acid have risen in the ranks, providing more relief at the 6-month mark than the 3-month mark. And finally, we're going to look at the WOMAC results at 12 months for intra-articular injections for knee osteoarthritis. And once again, platelet-rich plasma has coming in at number 1. So platelet-rich plasma provided the most pain relief and the biggest increase in functionality at 3 months, and again at 6 months, and again at 12 months. So platelet-rich plasma outperformed placebo, it outperformed corticosteroid injections such as cortisone, and it also outperformed hyaluronic acid injections at every interval mentioned in this randomized controlled trial meta-analyses of 30 different trials. So we got some good data here. PRP is clearly the best option not only at short-term as well as long-term 12-month follow-up. Also at the 12-month follow-up, placebo what came in number 2, followed by hyaluronic acid at number 3, and corticosteroids at number 4. This may be, explained, and I'm speculating here, just on the fact that hyaluronic acid and corticosteroids, those treatments, you need to repeat those. So if you just do a 1 and then you're following up at 12 months, you're probably missing the window of the best therapeutic outcomes. They probably dissipated, and at that point you probably want to repeat those procedures, and that's why it's an ongoing treatment, where the PRP is more of a regenerative medicine type treatment, where it's trying to improve the cartilage, joint integrity, tendons and ligaments. So it's not surprising that it would have a better outcome at 12 months than more of a palliative type of treatment. All right, so we're moving on from the WOMAC into the visual analog scale, VAS, and we're going to start off at the 3-month interval of 3-month follow-up. And the authors found, once again, they're looking at 30 randomized control trials, and this is a meta-analysis of almost 3,500 patients. At 3 months, PRP comes in number 1 for most pain relief, followed by corticosteroids, number 3, hyaluronic acid, and placebo, number 4. So this is a little bit different than the WOMAC results at 3 months. The similarities being PRP, once again, is number 1, but this time placebo comes in last. So it didn't have an effect where we're seeing some therapeutic effect of the hyaluronic acid and the corticosteroids. All right, moving on, visual analog scale, 6-month follow-up. So best results, once again, PRP, number 1 at 6 months for best pain relief improvement, and this is similar to WOMAC at 6 months. This is followed by corticosteroids, placebo, and hyaluronic acid coming in 4th at 6-month follow-up. And finally, the visual analog scale 12-month follow-up, 1-year follow-up of the different injection therapeutics for knee osteoarthritis. Once again, PRP is number 1 at 12-month follow-up, and this is the same as the WOMAC at 12 months. And in fact, PRP came in number 1 at every intervention follow-up interval. So 3 months, 6 months, 12 months, PRP was number 1 in therapeutic outcomes as far as pain relief on visual analog scale, as well as the WOMAC scale, which measures pain and functionality. So PRP was number 1, best at this at 3, 6, and 12 months on both scales that the authors analyzed. At 12 months, number 2 therapeutic was corticosteroids on visual analog scale, followed by placebo, and in number 4, hyaluronic acid. All right, so in summary, we looked at intra-articular injections of various therapeutics. The main therapeutics available right now, primarily corticosteroids, hyaluronic acid, and platelet-rich plasma. The intra-articular injections of PRP demonstrated the best overall outcome compared to steroids and hyaluronic acid and placebo for patients with knee osteoarthritis at 3, 6, and 12-month follow-up. Secondarily, corticosteroids and hyaluronic acid followed up with that, and placebo coming in last. No discrepancies were detected in these outcomes.